Does anyone want to see what Wegovy pen looks like? Here it is. This is the it's upside down. This is the Wegovy pen. This is what it looks like. Let me just show you. Let me give you a terrible demonstration how to use it. But maybe before we do that, I will find a better video that explains how to use the Wegovy. How to use Wegovy. Allow me 1 second. I'm searching the video. I know it's somewhere in the Wegovy website. Okay, there you go. This one. All right. But the thing is, okay, I wanna. Maybe I can find it in the YouTube. Allow me 1 second. So sorry for the delay. And how to use Wegovy. How to use. Never mind. So if you go to the Wegovy website, then you will see, you can find this video. Let me just share it. Present and stop screen, and I'm gonna share the screen. I see the Wegovy. There you go. Share. Okay, and then I will share the screen here. It's just that, there are so much things up and down. Okay, there you go. Let me play.
This video is based on the instructions for use that come with your Wegovy pen.
Yeah, I'm gonna.
You should store Wegovy in the refrigerator.
Yeah,
If your
I'm gonna
provider,
skip the
pen, we'll discuss
general
preparation to
part
make sure
and-
the medicine on the back has passed 2-5 or upper arms.
All
To
right.
start on with, you choose the injection site that's best for
Injection
you.
site, you
This
can
can be
inject
your
it
upper leg.
anywhere. Like, it doesn't really matter. They say like here, thigh, but it can be anywhere. One of my patients, he was confused with upside down, and he injected like this. This is opposite, and he injected it in the thumb. I asked him if it worked, and he said it worked.
Lower stomach or upper arms.
And there are so many videos, and on a social media you will find so many rumors about arm is better than belly, belly is better than arm. There hasn't been any consistency in the study that proved one side is better than the other. None. I believe these kind of rumors happen because somebody who was, most of the side effect that happens at the beginning of the course typically disappear after some time. So what may have happened is someone experienced some side effect after starting the injection on one side, for example, thigh, and 2 or 3 months later they saw something in the social media and they switched the injection site to the arm, and they say, after I moved, the injection site is completely gone. But even without moving the injection site, it could have been better without that. And nobody knows whether this is really because things got improved because of the injection site change or not. So we shouldn't be just relying on those individual experiences. We have to see the study, overall study, and at least with a good number of patients. But so far there hasn't been any study that tells us one side is better than the other. That's me.
You can inject Wegovy in the same part of your body each week, but make sure it's not in the exact same spot each time. Make sure to clean your injection site with an alcohol swab, or continue pressing the pen firmly against your skin for the entire injection, which should take about 10 seconds.
So
when you hear
I think I can explain better. Not better, maybe. Easy, super easy. Simply, why am I so small here? Okay, there you go. Simply open the cap, and you will see the needle inside. And if you are injecting it in the, somebody may misunderstand. If you are injecting it, let's say this is belly, not the arm. I'm not telling you to inject it in the arm. And you just, did you hear the click? Okay, and then you wait, you're gonna hear second click. Okay, so let me show you. This is not real, by the way. There's gotta be some way to kind of, reload it. This is just dummy pen. So you open it, right? So Wegovy pen is open, and you see the center, like the transparent liquid part, right? No problem. Somebody just said thank you, so that's why. Let me show. Okay, so it's here, and you press it. When you press it hard, you are gonna hear a click, and you will see the medicine going in, right? And then you will hear the second click, and that's it. Of course, it's a common sense. You have to keep it very clean. And I would dispose it in the, where is it? This one, the like a sharp container box. But at home, most people don't have it. Put it in a bottle, like a large bottle, like a milk bottle. Put it in there and close it, and then you can throw it away. Don't put it in a regular just trash bin. You shouldn't be doing that. What else? I told you about upside down and upside down mistake, injecting it in the finger. So be careful. Zepbound is okay. Zepbound has a much wider. It's much wider. They're not like a parallel and linear. They are much wider in the where the needle is located. So not many people. I mean, I've never seen anybody who's confused. But Wegovy is understandable. Anybody can get confused. So be careful with the side of which one is the needle side. I think that's pretty much about it. And I have uploaded many videos about the side effect and everything in my channel. Please visit our channel and watch more video. I'm really saying, I will just think 10 more seconds to see if there's any other tip. Oh yeah, one thing. Many times people inject it and they come back to me with a large bruise. That's not like some chemical related side effect. That's more like direct needle and bleeding under the skin. It doesn't happen all the time because you don't always touch the vessel, the small micro vessel. So my recommendation is after you inject, I'm not telling you to like press it harder and rub it. No, but gentle pressure there for like 1 to 2 minutes. Or just one minute is going to be good enough. That's going to prevent the large bruise there. So that's one advice. And one other advice is you may see the injection site like a redness. That's not really common with the Wegovy, but it more often happens with Zepbound. If you see any of them, then you can always apply like a hydrocortisone, like a cream, and that's gonna help. But I want you to understand, I had a case where it looked okay, but we just continued. But later on, it progressed to like anaphylaxis and like angioedema, like facial swelling and tongue swelling. So always be prepared. And I always just prescribe like some like an EpiPen just in case. And be ready for the worst scenario, even though most of the time, almost 99% maybe, that doesn't happen. But just keep that in mind. Thank you so much for watching.